everyone, I'm Sydney Greenlaw and I'm a third-year medical student at the Medical College of Georgia at Augusta University.
And I'm Jasmine Kaur, a CA3 resident at Medical College of Georgia at Augusta University. We would like to thank our mentor, Dr. Mary Arthur, who's the Anesthesiology Program Director, and our Research Associate, Ms. Nadine Odo, who helped us develop this project.
In this project, we're going to focus on cultural competence, which is a skill that allows us to understand and respect the values, attitudes, and beliefs of diverse racial, ethnic, and cultural groups.
This is a very important topic in healthcare as the population of the United States is becoming more diverse. And it has been shown that the differences in physicians and their patients, especially in regards to race or ethnicity, have shown to decrease patient satisfaction and increase disparities in healthcare.
Cultural competency is a way for us to be mindful and respectful of these differences and incorporate them when interacting with patients of diverse backgrounds. This can improve the physician-patient relationship while also eliminating the long-standing disparities in healthcare for minority populations.
While there are numerous studies that highlight the importance of cultural competency in healthcare, there are very few resources available that actually help us to implement this training among medical students and residents. This lack of training has led to increase in the gap of knowledge about how to best communicate with patients from culturally diverse backgrounds.
We believe this topic deserves more attention in medical education, which is why we have prepared this presentation. But rather than focusing on what cultural competency is, we wanted to provide you with some specific elements to give you the knowledge and skills that will make you feel more confident when caring for patients of different cultural backgrounds.
More specifically, we want to focus on the pre-operative visit because this is a very important encounter during which we elicit information about patient's history, medications, procedures, and so on, which is needed to guide the anesthetic care. If there is any bias or discomfort during this interaction, this can really limit the exchange of information.
While this video is especially relevant in anesthesia to help guide the preoperative interview, this information is useful for everyone involved in patient care and in any specialty. Now let's move on to our presentation, which is equipping anesthesia providers in the time-limited preoperative interview to more effectively evaluate patients through a lens of cultural competency.
We want to begin our presentation by focusing on the essential topics which are relevant to most cultures. To start, consider interpretive services if your patient is more comfortable speaking a language other than English. This can help to avoid any confusions or misunderstandings. Keep in mind that many different philosophies are related to health and illness. Ask patients what they believe about their condition. The influence of culture on health affects the perception of health, illness, beliefs about causes of disease, approaches to health promotion, how illness and pain are experienced and expressed, and where patients seek help, and the types of treatment patients prefer. This will help you to understand their viewpoint and show them that you value their beliefs. In addition, complementary and alternative medicine is used in many cultures and typically include herbal products. Ask patients if they use traditional or herbal remedies, as some drugs can interact with other medications or lead to bleeding during surgery.
Faith is often important to our patients. You don't need to be familiar with all the world's many religions. Instead, remain open-minded and ask your patients what they turn to for support during difficult times. When it comes to handedness, the left hand is considered unclean in many cultures. Therefore, to avoid offense, use your right hand to administer medication, hand objects to your patients, and so on. Using the right hand is generally considered proper etiquette. Colloquially across the United States, the term left-handed handshake is regarded as an insult and refers to insincere promises.
Let's now discuss some special considerations concerning Muslim patients. Muslims are individuals who adhere to Islam and Abrahamic religion. Muslims usually prefer to have a healthcare provider of the same gender. When introducing yourself, some female patients may not feel comfortable shaking hands. In such cases, greeting them by bringing your hand to your heart would be appropriate. As Muslim women dress very modestly, if you need to remove an article of clothing for an exam, ask for permission. If you and your patient are of opposite genders, try to minimize eye and physical contact as much as possible. A chaperone may be required in any examination requiring removal of clothing. Please inform the patient that the article of clothing will be immediately returned. In Islam, having a beard is considered religiously symbolic. If you will need to shave the beard for an elective procedure, seek your patient's permission to do so ahead of time. Not all Muslims practice their religion in the same way. For example, some Muslim women may not wear a scarf or hijab, and some Muslim men may not maintain a beard. Even so, they may still prefer a physician of the same gender, avoid pork, practice Ramadan, and prefer that physical contact be limited. At this time, let's talk about Indians. Citizens and nationals of the Republic of India are considered Indians. In contrast, American Indians generally belong to or are descendants of the tribes indigenous to the United States. In this presentation, when we talk about Indians, we refer to the people from the Indian subcontinent or of Indian descent. We have already discussed religion and the need for interpreter services in more general terms. However, we would like to emphasize these points regarding Asian Indians. India is the world's second most populous country, containing 17.5% of the global population. Some may assume that all Indians are Hindu or speak the Hindi language. However, Indian culture is not a monolithic and is very diverse. The Indian Constitution recognizes 22 languages. Hindu women may wear a cord or thread, a sacred necklace with black and golden beads called a Mangalsutra. Similarly, Hindu men and boys may wear a cord or thread around the wrist or chest. As these may be considered sacred, permission should be sought before removing them. In Sikhism, a turban called a dastar is an article of faith representing equality, honor, self-respect, courage, spirituality, and piety. Sikh men may prefer to have their heads covered during the entire time. The beard is also symbolic, and men avoid cutting or shaving it.
Now we will discuss people who are ethnically Hispanic or Latino. Hispanics and Latinos make up the largest population group after whites in the United States. It is important to note that Hispanic refers to Spanish-speaking individuals or individuals from a Spanish-speaking country, while Latino refers to individuals from Latin America. We are using both terms in this presentation. We will highlight important cultural values in the Hispanic and Latino cultures and how they can be incorporated into patient care. First, as a sign of respect, patients may not look the physician in the eye or question the physician. We suggest eliciting questions from your patients and identifying any misunderstandings. While most people value their personal space and feel discomfort or anxiety when their personal space is encroached upon, distancing yourself from the patient may be interpreted poorly. Maintain close but respectful contact and be polite to build rapport. Including the family during the preoperative visit may also be appropriate and allow them to participate in the conversation. Confirm how patients want to be addressed if they have multiple last names. Patients with Hispanic or Latino backgrounds may seek treatment from folk healers known as curanderos, who may use ritual prayer, massage, and reassurance to provide substantial relief for long-term complaints with many psychosocial overlays. The use of herbal preparations could, however, occasionally be problematic if not used appropriately. Let us move on to the African American or Black population. Blacks and African Americans are the second largest minority population in the United States, following the Hispanic and Latino populations. The Black population of the United States is diverse. African Americans, also referred to as Black Americans and Afro Americans, are an ethnic group consisting of Americans with partial or total ancestry from sub-Saharan Africa. In addition, many Black immigrants from the Caribbean, Africa, Europe, and the Pacific Rim now live in the United States, making nearly 1 in 10 Black Americans an immigrant or child of an immigrant. Being aware that African Americans would prefer to be addressed by their title, last name, and handshakes, and maintaining eye contact is vital to show respect and establish trust. Surgery is often a difficult situation for patients. Faith is an important component of Black culture, and patients may wish to include spiritual and religious leaders in health discussions, including praying before surgery. Occasionally, you may be asked to join your patients in prayer. Your decision of whether to pray with the patient is a personal decision. Introspection can enable physicians to provide a carefully considered response instead of an instantaneous emotional reply. In addition, a response that acknowledges and explores the patient's request for prayer can make them feel heard. Family, including extended family and kin networks, are highly valued in Black communities. Make sure to include family members during the preoperative visit. Throughout our interactions, we should be mindful that some distrust of the healthcare system exists, caused partly by past research and healthcare practices. Listening, communicating, and understanding their perspective will improve this in future interactions. Let's now move on to our final group, which is people of Chinese ancestry. The Chinese American community is the largest Chinese community outside of Asia. Chinese patients respect the authority of a physician. They appreciate verbal and nonverbal signs of support and value having a trusting relationship with their physician. Chinese patients may be more passive in their communication style to avoid being seen as bad patients. You may notice, for example, that they are reluctant to express having pain or discomfort. Be sure to ask if your patients are feeling pain proactively. Ask about traditional Chinese treatments such as acupuncture for pain and if they would like to consider that as an alternative approach for post-operative pain management.
Now that we are at the end of our presentation, we just want everyone to remember that not only is it important to know how to perform a history and physical exam in order to provide good care, but it's just as important to be aware of our patient's social and cultural circumstances. We hope this information was helpful and that you will be able to use it when caring for your patients in the future. Thank you for listening.